The name of this patent is the method of establishing an external blood-brain barrier model. We built this in vitro model of the blood-brain barrier, BBB. The main reason is that there is a selective barrier between blood vessel and the brain. We have to overcome this BBB to reach the place where disease pathology exists, such as brain cancer or Parkinson's disease or Alzheimer's disease. The three diseases treatment mentioned above using drugs must first pass through the BBB to reach the position of the target in cell suspension. Because our model has a transwell, transwell has been placed in 24-well plate and planted above with HP max cells, and then below with HA cells and HP cells. We performed the ratio test of the HA to HP at 1:1, 2:1, and 6:1. After analysis, it was found that HA and HP functions secrete some soluble factors, like TGF-beta1, which can effectively help to achieve the tightness of upper HB max cell, since the HB max cell exists on the most important place of outside the first barrier cell. Its closeness depends on the overall tightness of the entire BBB model and whether it is well established. Hence, we have to carry out different ratio analysis including the cell suspension and our culture medium. The ratio test of the culture medium is the same as the ratio of HA to HP. Then, the best ratio of culture medium we found to be 1:1, and the best ratio of cell suspension was found to be HA is 2 and HP is 1. In terms of application, developed in vitro BBB model was tested using two experiments: physical index of TEER and chemical property with PI. TEER and PI properties has been considered as two main factors to establish in vitro BBB model. With a very high TEER value and a very low PI value, then these important indicators can effectively help in the medical aspect or in our laboratory. Before to carry out experiments in animal models, there are very important indicators. There are some aging societies in Taiwan developed more commonly with Parkinson's disease or Alzheimer's disease. Originally, it may only be treated with drugs, but if this model is matched with our carrier and our BBB, the drug carrier can be more effectively coated with drugs, and then the target crosses the BBB. And to reach disease pathological location,